Florence Nightingale, a woman born into an upper-class family in Florence, Italy, that would pioneer nursing reform and make it one of the most respected and rewarding professions of modern society. She was highly driven by intellect, education, and religion. Florence experienced many calls from God to reduce human sufferings and promote healing. Nursing seemed to be the way that she would follow out this spiritual purpose. However, during the Victorian era, a woman of her status was expected to marry and become a hostess. Her dissatisfaction of these ideals was seen as alarming by her parents. Additionally, nursing was also considered a menial profession for lower-class women. However, despite her parents' objections and societal ideologies, Nightingale was committed to pursuing her call to be a nurse, and in 1844 enrolled herself as a nursing student in a hospital in Germany. Once she was an established nurse, it was Nightingale's work and care for the wounded soldiers at the Statutory Hospital during the Crimean War that pioneered not only nursing but healthcare reform. She and the team of 34 nurses that she had gathered were horrified by the unsanitary and inhumane conditions the patients were endangered to. She recognized that it was her mission to improve the hospital's standard of care to promote the soldiers' healing. She took a holistic approach to nursing and brought down the horrific mortality rates in the hospital from 42.7% to 2.7% in just a few months. Unfortunately, in 1856, Nightingale contracted Crimea fever, which permanently affected her health and well-being, forcing her to be bedbound for the remainder of her life. However, this did not hinder her from publishing her notes on matters affecting the health, efficiency, and hospital administration of the British Army, an 800-page paper of statistical data, charts, and facts that led to the evidence-based health reform. Nightingale died in 1910, however her legacy remains rich in the nursing profession, with the INC's International Nursing Day being celebrated on the 12th of May, the anniversary of Nightingale's birth. Develop unpacks 3 attributes believed to be required for a strong nursing leadership, these being innovation, emotional intelligence, and resilience. Nightingale clearly demonstrated all 3 of these characteristics throughout her legacy, with the innovative contribution she made to healthcare and the resilience to continue to reform nursing practice despite her crippling illness. However, what is most clear is how she demonstrated characteristics within Goleman's 4 domains of emotional intelligence throughout her nursing career. In relation to the first domain, self-awareness, it is evident from her writings that she exuded high levels of awareness, contemplation, and reflection on her own existence and purpose. She was intelligent, confident, humble, spiritual, and had a strong sense of purpose that continuously internally motivated her to lead nursing care change. Under the second domain, self-management, Nightingale was extremely logical and adaptive. She recognized there was a need for reform when she arrived to the Statutory Hospital, and this continuously drove her to take initiative and act accordingly, without having to be prompted by higher authorities. Nightingale demonstrated social awareness through her empathy, compassion, and care towards the soldiers. She recognized they are vulnerable with minimal social support and therefore advocated for their social, spiritual, and emotional needs to also be cared for. Her compassion underpinned and guided her care and the transformation of the healthcare system. Finally, though she may have compromised her relationship with her family, Nightingale's ambition, virtue, and kindness enabled her to manage and maintain relationships with her fellow nurses and patients, despite challenging experiences of working during the war. She was and still is an inspiration to many nurses, empowering them to use their power to implement change. Nightingale was also an excellent critical thinker. It was this and her emotional intelligence that recognized her as such an effective nursing leader. Nightingale demonstrated these critical thinking skills as she conducted research, first-hand assessments of the hospital standards, and implemented required intervention to improve the quality and safety of the care provided to the soldiers. She openly criticized the conditions of the hospital, such as how patients were laying in their own excrements and the presence of rodents throughout the facility. In doing so, she recognized her role as a nursing leader to reform and not always accept the status quo if patient safety is compromised. Through critical thinking, she was also able to apply her own evidence-based practice to recognize many soldiers were in fact dying from infection and sepsis and not their initial injuries, enabling her to then improve sanitary conditions. Ultimately, her ability to question her practice, reflect on its effectiveness, and implement more holistic approaches catalyzed widespread healthcare reform, making her an effective nursing leader of change who advocated for vulnerable patients. Nightingale left a legacy of principles that underpin the modern nursing profession. Her ideologies have surpassed through historical boundaries and continue to align with current approaches to healthcare. Her care of the wounded soldiers during the Crimean War constructed the foundation of holistic care. She advocated the importance of basic humane conditions in the promotion of health and recovery, providing clean water, ventilation, light, and adequate nutrition. This basic nursing care greatly reduced mortality rates, but most importantly, advocated for patient respect, dignity, and compassion. Furthermore, her work contributed to the foundation of infection control, patient assessment and observations, therapeutic communication, and spiritual nursing. An article published by Nursing Standard acknowledges how Nightingale's holistic lens is still visible in our current healthcare setting 200 years later. For example, Nightingale expresses in her book Notes in Nursing that a small pet animal is often an excellent companion for the sick, recognizing and addressing the patient's social and emotional needs to promote healing and recovery. In contemporary times, this is recognized as animal therapy, where the presence of dogs or other animals are used to reduce anxiety in patients waiting for examination results or procedures. Furthermore, she instead ensured holistic care by maintaining the soldiers' family connections and support, by assisting them to write letters to their family. Nightingale's empowerment, education, and support towards her fellow and junior nurses recognized her as the Mentor of Matron. This title highlights her contribution to the importance of mentoring in the nursing profession to promote professional development and patient safety. Through her mentorship of junior nurses such as Linda Richards, nurses now recognize that duties are beyond just to help the patients, but to also train, mentor, and assist others to maintain the continuity of high-quality nursing practice. The principles of mentorship contributed by Nightingale highlight the importance of experienced nurses being leaders and role models to those less experienced, sharing knowledge and skills to not only increase their performance and productivity, but also support them with easy integration into a new profession. Ultimately, it is this solid initial mentorship that improves the retention of newly graduate nurses into their career. A lot can be learned from my research into Nightingale's legacy of effective nursing leadership, and there are numerous attributes, values, and characteristics that I will implement into my own nursing philosophy and professional identity. When reflecting on her biography, her passion for caring for sick and vulnerable is something I believe will greatly influence my care. Like Nightingale, I do believe nursing is my calling. There are so many powerful motivating factors that drove me to this career that I aim to ensure that my professional identity and practice is reflective of these passions. Learning about how Nightingale demonstrated effective critical thinking catalyzed my own self-reflection and analysis of my own attributes and values to be a nurse leader. I have recognized that before beginning my career, I will need to develop self-confidence to be openly critical of the practice that might compromise patient safety and quality care. Even if I don't have an official title, as a nurse, I am a leader, and I should always aim to improve practice. Through further reflection and self-improvement activities, I hope to also become an advocate for my vulnerable patients. Nightingale's self-management, initiative, and adaptability in difficult situations has greatly informed my professional identity. Prior to my current research, I was having doubts in continuing my nursing career due to the fear brought on by the uncertainty of the current pandemic. However, reading about Nightingale's legacy, I am now more motivated to being a part of this change as we adapt our healthcare system to combat COVID-19. Finally, I have always resonated with Nightingale's holistic approach to nursing, as I greatly value and believe in nurturing a patient's emotional and social supports to improve their physical treatment and recovery. Completing this research has further solidified this in my own nursing professional identity.